we are looking at neonatal sepsis, and this is us looking at the what? Epidemiology. So epidemiology of any disease is like you are trying to look at how far has this disease affected the world at large. Okay, so for neonatal sepsis, you could actually see a map here, and this map, you have a color coding, right? So if you pause, you can look at the color coding. Of course, the red areas having the highest risk, okay, and all of that. Okay, so the epidemiology of neonatal sepsis is you are just trying to look at a glance. You are not a history student, but you just want to look at a glance. How has this disease actually affected people worldwide? That's children worldwide. You understand? You are trying to actually look at the countries that have the highest hit. Okay, so for global burden, we said that it affects about, if you are having 100,000 births, at least 937 of those newborns should be affected by neonatal sepsis. Okay, we have spoken about the causes, we have spoken about the presentations and all of that. Okay, so this shouldn't be strange to you. So annual cases, you're having about 1.3 million cases of neonatal sepsis worldwide, okay, occurring every year. So mortality, you have about 203,000 people, or 203,000 newborns, they die from neonatal sepsis yearly. So it's actually one of the leading causes to why newborns will die. Okay, so that's why they usually take this subject very serious. Okay, so trends and regional differences is increased incidence. So from 1990 to 2019, the global age standardization incidence rate of neonatal sepsis and other infections actually rose. Okay, declining mortality. So as it is rising, but because the healthcare system is actually improving, okay, we are now having better doctors being trained and all of that. Okay, so the chances of death, or how will I say, the cases of death has declined. Okay, so gender disparity, male neonates have a higher incidence. Okay, so born a man is a crime since from birth. Okay, just like that. Okay, male neonates are actually more predisposed. So regional hotspots, highest incidence is in the Andean Latin America. Of course, it's due to all the social and economic status. Right, the highest mortality is in the Western Sub-Saharan Africa. So risks and factors is prematurity and low birth weight. If a baby is born before time, of course, the immune system has not been trained to be on the outside world yet. Okay, then if you don't have access to good healthcare system, do you understand? And basically, these are the pathogens that are involved in causing early onset sepsis or late onset sepsis. All right, so the early onset is the group B streptococcus, Escherichia coli, and all of that, while the late onset is basically maybe complications from the hospital surrounding, okay, or surgeries that were done after birth and all of that. But at a glance, this is it for the epidemiology of neonatal sepsis.